reduction. 1927 thulium laser for pigment and rejuvenation. The name of the device is LavieenVOD. It brushed up my memory and made me remember LavieenVOD. Do I need a 1927 fractional laser in my clinic? I already have another ablative and non-ablative fractional lasers in my clinic. If you look at the absorption coefficient of these chromophores, the position of thulium fractional laser is here. The absorption coefficient is higher than the non-ablative fractional lasers, lower than the CO2 fractional laser. You remember that this area we can get non-ablative fractional treatment. With CO2 we can get ablative treatment. Does thulium treatment have ablative or non-ablative treatment? I think I can get both, depending on the condition of the skin and setting of the parameter. Look at this. When you see the epidermis, it has lower content of water compared to dermis, so there will be less reaction between the lichen tissue going through the epidermis. And especially in the horny layer, there is lack of water content in the horny layer. Whatever the parameter is, in different parameter setting, I have observed in the animal study that the stratum corneum is preserved even with high intensity of treatment. You can see the ablation of the epidermis here, but we can see some remnant of stratum corneum. So the reaction of thulium on the skin surface is quite different from the other ablative and non-ablative treatment. In non-ablative treatment, we don't have any ablative removal of the tissue, but the tissue is coagulated in the epidermis and dermis. In ablative treatment, there is real volume loss here, but think about the 1927. We can have some severe damage in the lower epidermis and upper dermis. Even in this condition, we can preserve the corny layer of the tissue. So, is it new technology? We can preserve the stratum corneum even with ablation of the epidermis and upper part of the dermis. The effectiveness of thulium is equaling to ablative laser treatment, but the side effect equals non-ablative treatment. So my conception for thulium treatment for outer surface is quite new technology with some advantages over pre-existing fractional lasers. This is LavieenVOD, uses 1927, and the spot size is about 0.2 millimeter. This is the screen panel of LavieenVOD. You can choose multiple shape of scanning, and you can choose watch and pulse duration. You can choose stacking mode and moving mode, whatever you imagine you can accomplish it in the machine. Separate setting of watch and pulse duration is very important. It is impossible to set these two parameters separately in Fraxel Dual. It is fixed fluence, but in LavieenVOD it is open to use technology, and we can stack the pulses. We can use the moving handpiece, and we can check automatically the depth of treatment. This is the study done on mini-pig skin by myself with this different energy level. 40 millijoule is stacking of 20 millijoule 2 times. We can see real ablation of the epidermis. With the same 20 millijoule, this is a stacking of 2 pulses of 10 millijoule. This is 120 millijoule pulse. It is different histology. With this mild coagulation with 12 millijoule, I use this for epidermal pigmentation, melasma, and Gaucher macule. And when the patient wants general improvement of their appearance, I use this mild parameter. 20 millijoule can be used for superficial rejuvenation, shallow wrinkle. Deeper penetration is good, suitable for deeper rejuvenation and pore reduction. And this aggressive treatment with thulium fractional, you can use it for scar and acne scar treatment. I like to talk to you. It is impossible with Fraxel Dual. when you increase the energy level, the pulse energy increases, the spot size increases automatically. So you have fixed fluence. All the histologic features made by different energy level is the same. The only difference is the size of the spot. So you cannot adjust your parameter according to your demand, how to treat the pigmentary problems like LavieenVOD. So this is the case that I treated with the thulium fractional LavieenVOD for rejuvenation. Whole face general improvement, rejuvenation plus brightening, textural improvement during scar treatment, wrinkle reduction, pore size reduction is achievable with thulium fractional treatment. Before and after, you can see some reduction in shallow wrinkle below the eye. Another patient before and after, you can see some removing the shallow wrinkles around the eye before and after. Another patient, you can see improvement of the periorbital wrinkle. At the same time, you can see some lightening of the pre-existing moles and freckles and lentiginous before and after. What you see here, I see the reduced size of the pore after treatment and general brightening. It is used for scar treatment. Acne scar on the right cheek before and after one treatment. Because it was 1 week after, I suppose there is some swelling effect to the patient, but anyway, it gives improvement in the scar treatment, before and after scar treatment. Also, thulium fractional laser, the LavieenVOD, can be used for pigmentary lesion treatment. We can target the resistant melasma with thulium fractional and freckles, and it's very useful for targeting ill-defined pigmentation and PIH and capillary macules, lentiginosis, and Becker's nevus. This is the case treated with thulium before and after. You can see some lightening of the freckles. If you notice the group of freckle on the root of the nose, it is almost gone after treatment. You can define the lentigine on the right zygoma. It can be targeted with thulium. When I'm targeting the lentigine, in addition to the general improvement, I increase the density in the lesion of the lentigine. That's why I have this kind of more reaction compared to other area, but it heals without any complication. PIH caused by acne eruption, it is gone with one treatment, with the fractional treatment. From now on, it is used for ill-defined pigmentation on the face, and sometimes you can meet patient who comes into your office room and, doctor, I have vacation of 3 days, I want to change my face a lot, I can endure some downtime. Then the first one is thulium fractional treatment for me, and mostly the patient is satisfied with thulium fractional treatment. It's because when we apply the Praxel, mostly 2 out of 3 answers me there is no change after treatment. But if you apply thulium fractional, because it is targeting the most superficial part of the skin, it is most visible to the naked eye. So 2 out of 3 replies, I got improvement a lot. So this is why the company want to call this machine BB laser. Like the BB cream, it camouflages the pigmentation and making the skin more elastic and puffy. Before and after, you can see some brightening and lightening in general, and especially in the freckles, it improved. Ill-defined pigmentation, you can see brightening and lessening of the color of the pigmented nevi and freckles. And PIH and lentigine got less pigmentation after treatment. You can notice this root of the nose improved a lot. This one case is combined with Olbium 약 treatment for the pigmented nevi, combination with Olbium 약 plus LavieenVOD showed much improvement after 1 month. there's a report of using thulium fractional laser for targeting post-inflammatory hyperpigmentation. If you meet very resistant hyperpigmentation, whatever the cause, maybe caused by burn scar, the pigmentation persists a very long time, then you can think about thulium fractional treatment. Among the pigmented lesion treatment, one of the most difficult condition is resistant melasma. It is well known to Western countries that fractional treatment is helping to remove the pigmentation in melasma patients. And there are many reports about it. And our experience in Korea is different from their experience. They are treating their Caucasian skin. We are dealing with the Korean skin. Our experience is just like this. After 1 or 2 treatments, the melasma responded very well to Fraxel treatment. Actually, the Fraxel is used for this study. But after 3 treatments, there was a recurrence of melasma after treatment. Maybe that is the common sense to Korean doctors. We don't buy their explanation about using Fraxel in melasma patients. We are worried about the recurrence after aggressive treatment like Fraxel for melasma patients. We should be cautious. But recently, with the thulium fractional laser treatment, there is new hope for getting better prognosis after treating melasma. It's because, as I explained to you, the histologic damage change made by thulium is somewhat different from other non-ablative fractional treatment. It can give very significant damage to the epidermis, but sparing the stratum corneum is beneficial. And I have seen many reports of using 1927 in the treatment of melasma. This is a report from USA. They have used 20 millijoule, 70% coverage. It's too big, too much for me. I don't dare to use 70% coverage. Then when it comes to China, they have used 10 millijoule, much milder parameter with 40% coverage. And they found that after 3 months, they have seen the recurrence of the same lesion. So this is much similar to my experience. I'm using 10 to 11 millijoule and use more than 200 shots in 1 square centimeter. And the coverage about 10 to 15%. So I can tell you I'm very cautious even using the thulium fractional in the treatment of melasma. And this is a very long interval between treatment. When the patients are pleased with the result and comes to my clinic again, it's very good for my melasma. I want to get the next treatment right now. Then I tell them I don't do it again until 6 months. After 6 months, it is stabilized. Then I can do the treatment again. But after 1 month, I think it is dangerous trial. After treatment of melasma with LavieenVOD, I experienced 1/3 of them shows much improvement, 1/3 slightly improved, and 1/3 there is no non-responding groups. Before and after treating the melasma, before and after one treatment, 1 month after one treatment, you can see improvement. Especially in my clinic, I use the thulium fractional for those very resistant cases of melasma. Those melasma that doesn't show response any other modalities, including laser toning, bleaching agent, or some advanced mode of laser toning, including the fractional 1064 laser toning, PTP toning, whatever. Then I try to choose the thulium fractional, and most probably I get some success in the patient. And Gaucher macule can also be targeted with the thulium fractional treatment. Look at the patient. This is Gaucher macule. If you tackle my diagnosis, I don't have any defense line, but I've seen many patients with Gaucher macule, and I know that this kind of faint discoloration progresses to definite color of gapillary macule. So I think this is gapillary macule. But one problem is when you treat the gapillary macule with this kind of faint color, there is about 10% chance of getting darkening of the lesion. It's very dangerous. So to be cautious, I can choose thulium fractionation. That's what I've done to the patient. You can still see some microcrust. It is after 5 days, still the patient shows some microcrust on the treated area, but most of the crust was peeled off already, and luckily you can see improvement of the color. This is another adult case with gapillary macule with irregular pigmentation. Not definitely the boundary of the gapillary macule, but clearly you can define the dark area here, upper boundary around this area, lower boundary here. But it's very hard to treat them because of the irregularity of the pigmentation, ill-defined border. So I chose thulium fractional. After 10 treatment, you can see improvement of the gapillary macule. Of course, we need to wait 1 year before we say it is cleared. Now, 1 year has passed for the patient, and I think it is stabilized, no more recurrence in the same area. If you see the backside of the calf of the same patient, you can see improvement of the gapillary macule with thulium fractional after 10 sessions. So this is summary for external usage of 1927 LavieenVOD. We can use LavieenVOD for pigmentary treatment, skin tone and texture improvement, epidermal melasma, freckle, gapillary macule, and age spot. And we can use 1927 for dermal remodeling, skin tone, skin texture, wrinkle reduction, lifting, and large pore size reduction. Especially in my clinic, I treat a lot of DY patients, so my data is skewed from the normal data. I treat the gapillary macule the most frequently with thulium in my clinic. And the second most commonly done procedure is general improvement for the patients who are on their vacation, want some significant improvement with some degree of downtime, then the BB laser is the optimal choice for them. And the third one is melasma.